Good afternoon, everyone. Give it a couple seconds, let people filter in. Okay, and I'll just start off with some quick introductions. Welcome to today's Research America Alliance discussion. I'm Tori Schneider, and I'd like to thank you for joining us on Zoom today and for your partnership in the Research America Alliance. I hope everyone is looking forward to this discussion today as much as I am. But first, just a little administrative housekeeping. If your organization is not a member of our alliance, I hope you'll shoot an email to Joel, our Director of Membership, whose email is in the chat to discuss joining us. And today, we are joined by Alison Feinswog, Senior Legislative Assistant to Representative Mike Levin. As a little background, last year, Representative Mike Levin and Representative Drew Ferguson reintroduced the bipartisan and very greatly named Saving Us from Pandemic-Era Resistance by building a unified global strategy, or Superbugs Act, to take coordinated, collaborative global action towards the development of pandemic, epidemic products, and including a particular emphasis on those that address the growing threat of antimicrobial. The bill text will be put in the chat for your reference. And knowing our alliance's interest in these topics, we have invited Alison to have a conversation with us about this legislation and the very, very dire need for different approaches to fight the problem of antimicrobial resistance. So please type your questions into the Q&A box or the chat, and we will pose as many as we can during the Q&A portion of today's session. Thank you so much for joining us, Alison, and I'll turn it over to you.
Yeah. Fantastic. Well, thank you so much for having me, and great to meet everyone virtually. As Tori mentioned, my name is Ali Feinswog. I am Senior Legislative Assistant, actually news that I don't think the Research America team knows, but soon to be Legislative Director next week for Congressman Mike Levin. And I've been with the team for a little over 5 years, basically since I started about 6 weeks after the congressman was sworn in as a freshman member of Congress in 2019, and have worked my way up, and I've been handling the health portfolio for probably 2.5 years now. And we, I can go into, how we got here. So, Congressman Levin, has been really interested in pandemic preparedness and AMR ever since the COVID-19 pandemic. He kind of came to us as staff and said, as he was watching the international response and the domestic response, said, what can we do to make sure this doesn't happen again and that we're ready for next time? So we met with a bunch of different organizations. Congressman Levin represents we think it's one of the most beautiful in the country, congressional districts that represents Southern Orange County and Northern San Diego County, 50 miles of beautiful Southern California coastline. And it includes a lot of amazing research and biotech institutions. We unfortunately lost UC San Diego in redistricting, but we used to represent them, and they have a fantastic pandemics lab. We represent a bunch of other institutions that are doing a lot of work in this space. So we met with basically anyone who would meet with us. We met with a lot of local researchers, local companies, national organizations working in this space. And I ended up identifying one thing that kept coming up in the conversation was antimicrobial resistance as a problem that isn't always included in the pandemic conversation, but is crucial and is already here and is a problem that we know we have to address. So we started drafting a bill that wanted to include pandemics and antimicrobial resistance in one, because we know we need products for the pandemics of tomorrow, and we also need products for the resistant bacteria, fungi, et cetera, of today. So we were looking at what we saw as gaps in the essentially the federal government response to AMR. And we saw that there was great work going on at CDC for infection tracking. We saw that there was work going on for proper use and making sure that we're not overusing antimicrobials, and some work going on in terms of access. But one of the keys to the puzzle that we didn't see happening was, how are we developing, once bacteria becomes resistant to existing treatment, how are we creating the next product that works on that patient and on that specific infection? So that's kind of where we ended up with the Superbugs Act. We specifically took a international affairs focus because that was kind of the lens that the congressman was looking at from the COVID-19 pandemic, but also because we saw that as kind of the gap in existing legislation. So some of you all might be familiar with a bill called the Pasteur Act, which doesn't talk about pandemics, it just talks about AMR, which essentially would be a subscription model to make producing new antimicrobial products financially feasible. And we're very supportive of that bill. We're one of the Democratic co-leads, but we also knew that we can't do our work in the US in a vacuum, and we need the international community. And we also can't go to the international community and ask them to do work on this without doing work at home. So that was where the Superbugs Act came in. Our co-lead is, as Tori mentioned, is Representative Drew Ferguson, Republican from Georgia, who is the main House lead on the Pasteur Act, which is why we very much see them as two sides of the same coin, and necessary for both to succeed. So essentially what the bill does is it would require the federal government. We currently, in the introduced text, we have HHS in consultation with the State Department. We've been asked by committee to potentially change that to be state in consultation with HHS, USAID, and other relevant agencies, which we're fine with that if that's what committee needs to make the bill move forward. To develop a strategy on how the federal government is going to work with foreign countries, multilateral organizations, and other appropriate entities, which we left open to intentionally include whoever the state and HHS deem necessary to work with, to develop a strategy to develop and commercialize pandemic products, including AMR products. So we focused the develop and commercialize piece. We focused on that. Obviously, everything else in the pipeline is extraordinarily important. But we saw that as the gap in where current federal government engagement was, which is why we wanted to focus in on that. And we intentionally included pandemic products, including AMR, because we wanted it to be broad enough to be a strategy that's kind of like a plug and play strategy, where you can create sort of the framework of, okay, what is the next thing that, pandemic that we're going to have to face? The federal government already has the strategy on how they're going to work with the international community on that. But we specifically wanted to call out antimicrobial products because we know that that's a problem that exists and we should be including it. We also, in receiving feedback, because we originally introduced like a very preliminary text at the beginning of the 117th Congress, and just kind of as a marker, like we're, getting this out there, claiming our territory, so to speak. And we worked through the entirety of the 117th Congress on feedback from HHS, from state, from a bunch of different organizations. And one of the things we got was we wanted to make sure that products was broad enough. So it included treatment, therapeutics, vaccines, diagnostics, everything kind of in the pipeline. So that was an intentionally making that so it included kind of everything necessary for combating these diseases. So we worked on edits all throughout the 117th Congress. We introduced a clean version at the beginning of last year, a little over a year ago now, and with Representative Ferguson, and we are working on trying to get it across the finish line. It's the nice thing about the bill is it doesn't cost anything. We know that eventually there will have to be, if this bill were signed into law and we were actually to enter into agreements with foreign countries or, multilateral organizations, that there would probably be funding that would have to be associated with it. But we intentionally left any kind of authorization off the table because that was what it was necessary to get it bipartisan, especially with our current, requirements of any increase in funding requires a cut in funding from somewhere. And, that was not a conversation we were at this point that we need to have. So we know eventually it'll have, deals down the line. We go through the strategy in the bill and say, we leave it open to what the federal government thinks is best, but we very much envision it as, it can be anything from agreements with other countries to contribute to commit XYZ amount of funding to research, development, and commercialization. It can be, some kind of quasi centralized fund, a la the global fund, where, we all contribute, commitments from private companies, all that. Is on the table in terms of what sort of the actionable pieces of this would be. So in terms of strategy, this was referred to the Foreign Affairs Committee, which is at first was, I think, a little bit more of an education process because, a lot of the Foreign Affairs Committee members weren't as familiar with and AMR as some of the, more health focused committees were. And we've, I think, done a really good job of that. Both majority and minority staff on committee is very aware of this and actively working with us on changes. The minority staff asked us to get an edited version because they were trying to get this to markup back in April, and unfortunately the slot fell through and they weren't able to get this to markup, but it's very much on the table. And we essentially, our strategy going forward is making sure that we clear all the hurdles that we need to with foreign affairs, because ultimately we think that the best chance for this to move is with the Pasture Act. And Representative Drew Ferguson is retiring, and he's a well-respected member of his caucus, and he is pushing the Pasture Act as his number one legislative sort of legacy priority before he retires. So we are trying to make sure that we have all of our I's dotted and T's crossed with the Foreign Affairs Committee, so that in the case the Pasture Act moves, we are able to attach it. So it's that perfect, kind of domestic and international approach altogether. So that's, we're continuing in order to sort of get traction from foreign affairs. We're adding co-sponsors in bipartisan pairs. I think if any of you are at all interested in talking with me further about getting engaged on the bill, I would love that. Whether it's reaching out to your respective members of Congress to try to get them on the bill, especially Republican members of Congress is most helpful because we do have a couple Dems waiting for Republican pairs. And specifically Foreign Affairs Committee members are also very, very important, just to, make sure, obviously this is on the committee's radar and they're pushing for it, and the majority, I've met with them, and they're, also don't have any major flags about the bill, which is exciting. But, I think in order to get this to the point where it comes to markup and we have, the full support of the committee, we need more support. So that's kind of the overview of the bill, and yeah, look forward to any questions.
Thank you so much, Allison. That was a great overview. I have a few questions. I'll start with, just to kick us off. You touched a little bit on how this legislation, in terms of the international component, you see it fitting into existing roles that the U.S. is already playing in the international community in this space. wondering if you could elaborate a little bit more on that, how you all foresee that streamlining the process of R&D, and also how, if at all, you guys have thought about how this legislation complements existing programs, not only just on the U.S. side, like, work at BARDA and ARPA-H that's already ongoing for AMR, but also international initiatives on this front as well.
Yeah, absolutely. We very much see this as a compliment, not a stomping on people's toes attempt. Just I think the key to this is getting everyone in a room together to make sure that we have a comprehensive strategy. We want to make sure that it's working with BARDA, CEPI, all of the efforts that are currently going on, which is why we wanted to include, like, in the new draft of the bill, we include USAID because they obviously do a lot of great work on access and appropriate use around the world. And we very much see this as complementing the work and creating a framework for the work that's already happening. We include a line in the strategy that's saying, make sure it's harmonized with existing agreements and work going on the federal level.
Great. Thinking through the global community aspect of this bill that makes it unique in that sense as well. Obviously, even just thinking of antimicrobial resistance as an example, the disease burden in the U.S. when it comes to AMR can be very different from the pathogens that other countries are dealing with. So I'm curious if you all have thought of ways that this legislation would help facilitate, not just thinking necessarily about antimicrobial pathogens that are prevalent here in the US, but also thinking of ones that are mostly affecting the international community as well.
Yes, no, we definitely see this as, supported. I think that's the important thing about making sure that state and USAID are at the table, is that they're going to be much more tuned in to the threats that are affecting other places in the world. And, some of the things that we've kind of tried to use in our conversations, specifically, predominantly with Republican offices, is that this is a national security issue because, when you have our troops going to other places around the world and getting field infections, those are much more likely to be resistant to existing treatments. And we want to make sure that it ultimately investing in those other pathogens or resistant bacteria in other parts of the world is ultimately going to help us here, because we're a healthier world is a safer world.
Definitely. We had a couple of pre-submitted questions that focused on issues surrounding the public's engagement with antimicrobial resistance as well. If there's any component to this or the Pasteur bill that you could speak to where you all see this fitting in terms of increasing the public's role in knowledge about AMR, ways to combat AMR, misuse of antimicrobials, and generally just the sort of communication between officials who are trying to work on these problems and the public who's also dealing with these in very personal ways.
No, absolutely. I would have to go back, and just because I'm not as familiar backwards and forwards with the Pasteur Act as I am the Superbugs Act, because that's obviously my my responsibility. So I would have to double check on Pasteur, but for Superbugs, we definitely we don't have any language right now specifically talking about public engagement on developing the strategy, but I'm more than happy to take a look at including that. We definitely see engaging patient communities, engaging, affected communities that have disproportionate burden as crucially important to making sure we know what we're prioritizing and what we should be prioritizing. So yeah, more than happy to look into that.
Yeah. And I guess one more question from me on the more sort of just personal interest side. This bill is so, like you said, it's broad sort of by design, like it can fit in a lot of different roles and enable a lot of different, forward momentum on these issues. Is there a particular part of it that you or the representative are particularly excited about that really energizes you about this work? And just curious if there's a part of it that really stands out to you as something that is really unique about this and that you're really excited about.
Yeah, absolutely. I think, the piece of engaging, and making this a priority on the international stage for us. I think there are aspects that, the international community is talking about this, the UN is talking about this, WHO, but what makes us excited is making sure that the US is a leader in those conversations, and that we're bringing our money and political will and power to the conversation. And I think getting this as a priority on the national stage, on the international stage, is what makes us most excited.
Great. You touched on this a little bit while you were speaking, but just in terms of ensuring that the members of our alliance who are joining us today know how to get in contact with you, what actions would be most helpful, how they can most effectively let their representatives know about this bill and how best to support it. What would be your recommendations there?
I'm on mute. There we go. Yes, I can drop my email in the chat right now. There we go. And so that's the easiest way, obviously, to get in touch with me. And I can help brainstorm and talk about the bill more, or figure out, what's kind of the best way you all can be helpful in terms of contacting your representative. We have a one-pager on the bill, which I'm not sure if I can drop in the chat or if someone else can drop in the chat. That's an easy thing to send to, the health staffer for your respective member of Congress. But yeah, we're basically, any and all support that we can get is helpful, whether or not you all are from an organization that endorses legislation. We would love to include you all as an endorsing organization, which would just basically mean including you at the top of our one pager. Or if that's not possible, or in addition, any kind of outreach to your respective member of Congress about co-sponsoring. And that's especially if they're Republican, and especially if they're a member of the Foreign Affairs Committee. Yeah, so that would all be extremely helpful.
Great. And if you send that over to Jacqueline, she'll definitely be able to put that in the chat for everyone to access. And speaking of which, I would now like to ask my colleague Jacqueline to join me so that we can answer some questions from the audience. And please keep submitting those.
Thanks, Tori, and thanks, Allison. This has been a fantastic conversation so far. So for our first audience question, I'm also curious about this one. So when we're referring to antimicrobial products, are you specifically referring to therapeutics, or are also considering household products like sanitizers, cleaning products, etc., as all of these similarly influence AMR?
Yes, absolutely. So the term antimicrobial products comes from the statutory definition of pandemic products, which we intentionally chose. I have to double check what is included in the pandemic products definition, but it 100% includes therapeutics, vaccines, treatments, and diagnostics. In terms of, I don't think it would include hand sanitizer and other cleaning products, but I can 100% double check.
Great, thank you. Sounds good. All right, for our next question, this is kind of similar. What can ordinary citizens do to help mitigate the escalating antimicrobial resistance threats?
Yeah, absolutely. It's, I think part of it is, your own responsible use of any kind of antimicrobials that you get prescribed, antibiotics or whatnot. Part of it is on, that's on the individual level. Antimicrobials are used not just obviously in, your individual health, health prescribed to you, but also are used in agriculture. That's a huge issue of increasing resistance in agricultural products. So on the provider level, it's, making sure providers are aware of, and are prescribing antibiotics and other antimicrobials responsibly. There's a bunch of different ways, but I think, on an advocacy point, I think talking to your member of Congress about both pasture and obviously unbiased superbugs, or because I think a lot of the problem is in terms of having the next products that are going to work against the newly resistant pathogens is a lot of these companies don't have the financial incentive because essentially the whole point of an antibiotic is you don't want to overuse it. And that's because then the bacteria becomes resistant and then it just becomes defunct. And that can be hard for a, small biotech company who's trying to, decide, are you going to sort of work for something that, we're going to try to get everyone to, with XYZ disease to use versus something that needs to be used more responsibly, which is kind of the idea behind the Pasteur Act, is to create an incentive structure to create these products that are supposed to be used responsibly and make sure that that's, financially doable for these companies that are just starting out. So there's a lot of different points in the process on the individual level, provider level, hospital level, as well as agricultural and policy and all that.
Great, thanks. Touched on a lot of great points there. So our next question, AMR is a very big interest to all hospitals in the US. One of the areas that we have struggled to find support for, and this is coming from someone from Mass General Brigham in Boston. So one of the areas that they've had struggles to find support for are educational programs and meetings to advance this issue. This seems to be a gap in most initiatives. Do you have any suggestions or thoughts?
Yeah, absolutely. Know Mass General very well. I went to Tufts up in Boston for undergrad, and definitely got healthcare at MGH. So in terms of educational opportunities, I think there are a lot of groups that are engaging on this issue. I mean, it really depends on what level you're talking about engagement. If it's, from the provider hospital level, I think, making sure that you're engaging with the major, hospital and provider organizations to make sure that this is a topic of conversation at their conferences and, any other kind of, outlets that they provide. And I think that comes from members saying, hey, this is important. And apologies if you just saw my coworker's dog walk behind me. It's my coworker's AC broke, so we have a furry friend in the office today. But I think raising this issue with any kind of obviously Research America is talking about this issue, but any other kind of physician or hospital organization that you all are a part of, to make sure that this is a topic of conversation and figure out what best practices are for hospitals and providers. I think that would be a good place to start.
Great, thank you, Allison. Next question. Are you worried at all that AMR will get, quote unquote, lost in the generally accepted understanding of pandemic products and interventions?
Yes, that's why we called it out specifically. So we wanted to make sure that it was included specifically in the bill, because I think if we had just said pandemic products, it wouldn't necessarily have been included. So that's why we wanted to make sure that was, at the included from the onset in the bill text.
Great. Sounds good. Our next question in the chat. Can you speak more on your strategy for ensuring equity in patient populations, engagement strategies, and how or if this bill covers equitable access to future AMR products and technology?
Yes, that is something we're actively working on in our edits to the bill because, we generally obviously are supportive of equitable access, but have been trying to include some more updated language, making that more explicit. I think in the most recent edited version are trying to include information or include in the strategy, make sure that we're creating coverage and reimbursement pathways to make sure that once we're creating these new products that they're covered by, at least in the US, covered by variety of health insurance providers, but definitely interested in including some more language there. If you guys have any suggestions.
Wonderful, thank you. There's not currently any audience questions. I'll give it maybe a few seconds for anyone to add some more questions to the chat or Q&A.
We have another quick question for you, Allison, knowing that Representative Levin, representing a district in Southern California, I know he's also been sort of pretty involved on the valley fever fungal disease discussion as well. Would love to hear any, obviously this bill, it fits into that work really well. If, there's any other initiatives from the California side of things on the valley fever front, something that we've been pretty engaged on as well, that you would like to discuss, or anything that anyone can help in terms of doing that work as well.
Yeah, absolutely. We've been very engaged and very much see this as a part of the puzzle when it comes to valley fever. We worked very closely with the Valley Fever Institute in Bakersfield on this bill, and they've been extremely helpful, as well as MyCare, which is kind of a fungal disease alliance that's recently been created. We actually were able to, our strategy last year on this bill was we were able to actually get then Speaker McCarthy interested in the bill from a valley fever perspective, and he was actually the one who got this bill to the attention of the majority staff on committee. So, we're still very much engaged with this from a valley fever perspective. We led a letter with one of our Republican California colleagues talking about the importance of advancing valley fever related legislation and the Pasture Act and Superbugs being sort of foremost among those. There are several bills as well, like being run out of the Valley Fever Task Force, which we're a member of, that have to do with very Valley Fever specific bills. But we ultimately, and those bills are great, but we ultimately think that having a antimicrobial wide response is probably the most effective because, obviously this is an issue that spans, the variety of different types of infections. And we think that, when you're doing research on one fungal disease, it's going to, that research may end up helping another fungal disease, as well as, antibiotics and all that jazz.
I love that, antibiotics and all that jazz. That's going to be the slogan coming out of this, I think. Well, Jacqueline, I think if we don't have any, do we have any other questions as well?
No, I don't believe I see any more. We had one, but I think Allison just answered it. So
great. Well, thank you so much, Allison, for joining us today, and many, many congrats on your promotion up to LD. We're definitely very excited to continue working with you in the representative's office, and I'm sure a number of our Alliance members here on the call today are also excited to reach out to you as well. So in terms of wrapping up, we'd love to thank everyone for joining us today, for your thoughts and for your participation. Before you go, if you are a Research America member, we hope you can join us next week, May 15th at noon Eastern Time. We'll have Jonathan Daniels, Deputy Director at the Coalition for Health Funding, to discuss the current FY25 budget process and what's next. Both the House and the Senate are determined to complete their versions of all 12 fiscal year 2025 appropriations bills well before Congress adjourns for August recess. At the same time, there are valid concerns regarding the insufficiency of the debt ceiling deal-imposed caps on defense and non-defense discretionary spending. What does this all mean for federal funding needed to drive scientific, medical, and public health progress? Participate in this off-the-record virtual conversation for answers to those and other questions arising from yet another tumultuous appropriations process. If you're an Alliance member, look out for the registration link in your inboxes this week. Thank you all again for joining us today. We look forward to seeing you again soon, and have a great afternoon.